So the next panel is titled The Power of You, Mastering Your Glaucoma Journey. This panel discussion will focus on empowering patients with knowledge, tools, and resources they need to navigate their diagnosis with confidence. It's going to feature patients, caregivers, and healthcare professionals who are going to share their personal stories and insights for mastering their glaucoma journey. So I'm going to introduce a few people. I'll be the moderator for the session. The first panelist, hopefully everyone is here, is Gary Asano. Dr. Asano is a low vision rehab specialist. If he is here, he can come up to the stage and actually have a seat up here. Come on up. Joanne Giacconi is a professor of ophthalmology at UCLA Stein Eye Institute. Hi, how are you? Come on up and also have a seat. A glaucoma patient, Amy Dixon from this morning. We are so excited to have you back on the panelist. And you can come have a seat on the sofa. And then Tarika Roberts, or Tarika, I don't know which one it is, but she is a mother of a glaucoma patient. Oh, thanks for coming here. Come on up. And I'll have you guys sit on that other end if that's okay, if you can manage that. Okay. Okay, this is going to be a great session. Sorry, let's make sure I got everybody. I called everybody up. All right, Michelle's giving me the thumbs up. I'm not missing anybody. Very good. Speaker bios are on the website if you want to learn more about the different speakers. We have, a variety of people up here, and I always like to start with the patients. And we've heard from Amy this morning. I'll have you come back in a second, but I'd really would like to hear the story of, is it Tarika or Tarika?
Tarika.
Tarika, I did say it right the first round. I would really love for you to tell us your journey and tell us your perspective.
Okay.
So I'll start with you.
Tarika Roberts. This is Grayson Roberts, my son. He was born with glaucoma. He is, you want to introduce yourself? Go ahead.
Hi, my name is Grayson, and I'm 9 years old.
And of course, he has glaucoma, and it's been a journey. It's been a journey. It was something that we never expected. Of course, we didn't find out until he was born. He's now undergone 32 surgeries, including cornea transplants. He has, like you said, 4 stents put in, and yeah, it's been a journey.
What advice would you give to parents of children with glaucoma?
One day at a time. One day at a time. It is a process. The medication is a process. Being able to get to a place of stabilization is a process, up and down. It switches, it changes sometimes month to month. Each appointment, it may be back up. It could be frustrating. It could be overwhelming, but it's just stay calm, stick to the script, follow your doctor's guidance. We keep records. We take our records in just in case we may have missed anything. We may have missed a drop. Sometimes that can cause it to the pressure to spike. Keep an open relationship with your doctor.
Yeah, that's, how old was he when he got diagnosed, you said? Right at birth?
Yeah, at birth, yeah.
Okay, interesting. We had a discussion about, do children get glaucoma, with a group of people at our lunch table, and I said, yes, they do. And when they're born with it, it's obvious, and so they're usually streamlined into a clinic right away. It's not quite like the older population where primary open-angle glaucoma, where it's kind of silent and not noticeable. It's a little bit different.
So for Grayson, he was born, his eye never fully developed. So his eyes never fully developed, which has caused it. So when he came out, his eyes were completely white. So he was flown over to Kaiser Redlands, where he received emergency surgery. So it happened immediately.
Yeah.
He's 9. I'm sorry.
How
How well is he doing now?
His corneas are in the failed state. We're actually going for surgery on July 5th, where he'll receive new corneas. So keep us in your prayers. He has not had any since he was 3. I keep a very, I'm moving ahead of the questions.
I like it. No, there's no rule or rhyme. You just keep flowing, and then I'll kind of moderate back and forth. But whatever you feel like talking about, you can.
So I'm very big on making Grayson a part of his treatment. I believe he is the specialist. He is the one who can tell us what's going on with him, what he can see, what he can't see, what hurts, what doesn't hurt. And I'm big on making sure that he is comfortable throughout the process, that he's aware, that he knows what's going to happen, and he understands what we're up against. He's good at asking questions. It could be a little traumatic, going in and out of surgery. So it's important to me that he's aware of those processes and what to expect.
Do you feel like, how do you deal with the anxiety of going to the doctor's appointments?
Do you want to answer this?
Yes.
Go ahead.
How I deal with anxiety, I research videos of like the surgeries that other blind people went through that I'm doing.
So he likes to prepare himself. We'll make a list of questions for doctor. We have doctor on speed dial.
Doctor, who is your doctor?
Dr. Reiser out
yeah.
of Children's Hospital. We love her. Her and the PAs. We go through them. But if we have questions, I was experiencing a little anxiety with this new transplant coming up, and I just reached out and I, expressed my concerns. They replied immediately with, what the procedure will look like, how it'll be a little bit different than what we've experienced before. So it's important, just keep an open dialogue with your treatment team.
Yes. I mean, so I know Dr. Reiser personally. She's a magnificent surgeon. And so you have nothing to worry about from that standpoint, But I will say that, he's been through a lot, so that creates anxiety. But there are a lot of our patients, same thing as adults, that have a lot of anxiety when they come into their doctor's appointments. I'm sure they don't even reveal to us as the doctor, right? Because you want to keep that straight face. But I'll give you a little break from all the questions so that you can chime in. I'm actually going to turn it over to Amy for a moment. I wanted to get your advice and kind of from an adult standpoint of how you deal with your doctor's appointments and the kind of the worry that may be ensuing before each one.
Well, I've been really lucky, like this smart young man over here. I do my research and my homework ahead of time, so I feel empowered walking into my appointments. And I've been really blessed in that I found like the grand poobah of all doctors in James Sy and Bob Weinreb and Larry Iannuzzi and Stephen Foster as my care team. And so I know that I've got the best of the best working on my eyes. So if I'm worried with them, then I'm really in trouble, right? Yeah. So I really just focus on the fact of gratitude and that I'm very lucky to be born in a time when we have such incredible medical advancements and the technology that's available right now. And I know that they're fighting because they have a vested interest in my care and they look at me as a person that they're fighting for me too. And so it gives me confidence. So I don't really worry because we're doing the best we can with what we have. And in the future, it's only going to get better. Yep. So if I lose my vision during that time, I mean, we have so many resources that are going to help me continue to live a full life. So I only have about 2% of usable vision, and like this young gentleman, he's catching up to me. I've had 39 surgeries to save my sight, and multiple complications and side effects of different drugs. But again, I'm lucky that I have those options. I live in the United States, one of the most advanced countries in the world for medicine. And if I was from somewhere else in an obscure small nation, I might not have had those options. So am I scared? Of course. I would be lying if I wasn't afraid at times. But I also have to remind myself in those moments how grateful and how lucky I am to have the care that I have, and I've done my homework, and the rest is up to the universe.
That's great. What an incredible perspective and attitude you have about this. This is great. You're like a perfect, you guys, you two, you three are perfect for this interface with patients who may have fears, who may have worries, who, this is the forum for that. And I really encourage getting to know each other outside of this, this little panel to kind of continue getting inspired. I will turn it over to Dr. Giacconi, who practices in Los Angeles. When do you think a patient should see a glaucoma specialist? And what if they don't have access to one?
So thank you. I think a patient should see a glaucoma specialist whenever they feel like they want a second opinion. Or if they're uncomfortable with something that their own doctor said, or if they're sensing that their own doctor is feeling a little bit uncomfortable with what's happening with them. If you're told that you're progressing quickly, I think it's time to see a glaucoma specialist. And a glaucoma specialist is not just for someone at the end stage of their glaucoma. Someone who's told you're a glaucoma suspect or your pressure's high and everything else looks normal. If you want, go see a glaucoma specialist. You don't have to stick with that person, but if you want more information, it can be nice to go there. Sometimes in a glaucoma specialist office, there's a lot more diagnostic equipment to give you like a fuller picture of what's going on. If you don't have access to a glaucoma specialist, and I guess who has access and who doesn't depends on how far you're willing to drive or perhaps fly. You could ask if a doctor's office is willing to maybe do a video visit with you, if you can gather all of your information and send it to them to review ahead of time, and then they can spend the 20-30 minutes on a video chat with you, or if you don't have video, like a telephone chat with you, to give you an opinion on what they see about all of your past data. So,
and do you sometimes maybe as a specialist, stabilize the patient or operate, stabilize, and then send back to their comprehensive doctor?
Oh yeah. So glaucoma is, as you all know, it's a chronic disease. It's a long game, and the eyes can have, can sort of sprint ahead and get worse, and then you'll do a surgery or change medication and things will stabilize, and it's okay to go back to your general eye doctor, and they can watch you. Like the glaucoma specialist may give your doctor parameters, like, I want to see this patient back if this changes on the visual field or if the pressure goes above this level. So you can get your ophthalmologist or maybe optometrist to work as a team with the glaucoma specialist, so that you don't have to always drive far away or wait in the office for hours and hours, since there's not that many of us.
Okay, so
Hours and hours.
Yes.
hours and hours you drive, right? And
Not drive, just wait.
wait,
for
yes.
hours.
Children's Hospital for sure. I've rotated there, and I know how that goes. But it's the name of the game. It's very few pediatric specialists in both cornea and glaucoma, for example, or very few glaucoma specialists within, we're lucky we're in Los Angeles, so there's a bunch, but, there are people who drive for sure from many hours away.
I've met people in the waiting room who I've become really close with, friends who fly across the world for appointments with doctor.
Wow. Yeah.
And like you said, like we have her in our backyard.
Yeah.
So I can sit there and wait for hours.
Yeah, that's right. I wanted to talk a little bit about, and I want to ask everyone from the panelists to talk about it, about the second opinion and when communication kind of breaks down between you and the patient or you and the doctor. Now, maybe you're one of the lucky ones and your doctor's been awesome since day one, but I am sure that there are patients who question, like, am I at the right practice? Am I with the right doctor? What am I? So I'm just going to go down the line from Amy down all the way to, like, what is it that, from a patient perspective, and then Giacconi, from a doctor perspective, like, what is it that you can either advise or, like, as far as that, when you kind of feel like you need a second opinion?
I think no matter what, I think you should get more than one opinion. It would be wonderful to think that we're all extremely knowledgeable and have the foresight to nail it right out the park. And if you're that person, then fantastic. But I think it's always valuable to line up to appointments upon diagnosis because, again, this is going to be a lifelong journey for you. And it may not even be their medical expertise that's the challenge, it's their personality. And I mean, not saying that you have to be best buddies with your glaucoma specialist, but this is the person that's gonna be in your life for a very long time. And so I think it's really important to find that fit. And again, medicine is a business. You have the right to take your business elsewhere. No HMO on the planet is gonna make you go to only one doctor. So you have the right to take your business. It's a $40 copay for most people. Spend the extra $40 and go see a second person, and then make an informed decision once you've had a chance to see both doctors. I realize it's a big commitment for a lot of people, but obviously this is your site you're talking about. You don't get a second chance. So, I mean, do everything you can to put yourself in the best possible position.
Yes. Dr. Giacconi?
So I think anytime you feel comfortable or you just sort of have this nagging feeling inside that you want a second opinion, it's good to go get one. Be prepared, though, to get differing opinions because you know, glaucoma is not 1 + 1 = 2. There's a lot of variations. You know, people who train on the East Coast are trained a different way than people maybe on the West Coast. You know, people with different experiences may recommend different things. So, you know, be prepared for possibly differing opinions. And if you get differing opinions, then maybe you want to go for a third opinion. And then, you know, as with anything in medicine, it's a partnership between you and your doctor as to what the doctor is comfortable and knows to be bad or good for you, and like what you're comfortable, what risk you're comfortable taking. So yeah, like I said, anytime you feel that nagging feeling like I need a second opinion, I think, you know, go get one.
For me, Grayson being born this way and him having to go through emergency surgeries, it was like Dr. Giacconi explained, where we were stabilized by someone who could do it on our network, which was Kaiser, and then we were transferred over to Children's Hospital like months later. And for us, Dr. Reiser has a special personality, but I also had to look at the other perspective. They're seeing hundreds of kids, sometimes in a day, and I didn't need her to be my friend. I needed her to be the doctor. And I had to take myself and my emotions out of that and allow her to do that. And sometimes that may involve a very cold or stern demeanor from her. But I just, my personality was, I was gonna make you like me. I was gonna make you talk to me. And so I would just bring in all of my research, journals, articles, latest, and she appreciated that. And she appreciated the questions, and she just started taking her time, and it worked. And I did. I researched different doctors. I researched her background, what she knew, how much she knew. I talked to doctors on the East Coast, all over, and just got to the point to where we were most comfortable with where we were at.
That is a really great point, because you can have difficulty speaking with, because you can have different personalities, right? Not everyone's going to be warm and fuzzy every single visit also, right? Because some days there's a lot of patients and I can't chat as much, right? There's all these little things. And so, or that might not be somebody's personality, is like, you know, they're just stern, that's what it is. And you have to decide what is important to you. You know, for me personally, I always want a good surgeon. Like, I don't care about the personality, but everyone's a little different, right? So, you know, and if that's something that's really important for you to be able to communicate and talk and discuss and spend time like that, then you may want to get a second opinion. And that person may or may not exist, but at least if you get that second opinion, you'll have some idea, you know? Dr. Asano, you are very quiet over there. We're going to have you chime in. As a low vision specialist, you probably see people coming in from all different doctors. And any perspective on that, on like people saying like, oh, like my doctor doesn't talk to me much. They don't spend that much time with me like you do for an hour in the low vision clinic. What advice do you have for both the doctors and the patients?
Well, you want to make sure that the doctor is treating you as an individual, not just an IOP, not just a visual field, and is actually listening to you for the time they have, but still they're listening to your exact problems. For instance, I've had one patient where the diagnosis was macular degeneration, but the problem is that the person, just in taking even the visual acuity, she said, "Stop moving the chart." And her husband said, "He's not really moving the chart." He might be moving it maybe in a millimeter or something, right, for that matter. And what I found out is that the person had a big problem with a dry eye, but that wasn't diagnosed. And a dry eye, yes, sounds like a simple thing, but the front of the eye is so much power. It's 66 diopters, so it's 5 times the amount of power that the lens inside the eye is. So any irregularity there of the tear film on it is going to make a huge difference in the vision. So is the doctor treating you as an individual, like I said earlier?
Okay, great.
I have something to pick up on that Tarika said that I think is very a good point. You know, it takes a little while to build a relationship with patients and, you know, you with the doctor. I find that I have some patients where I don't feel like we have like a great bond, but then it gets to the point where they need surgery, and with surgery, you know, we see each other so much, and then like the relationship sort of changes, you know, you just feel closer. Like I think you both feel closer. So, you know, you may not think the person's very warm and fuzzy the first time or first couple times you see them, but the more you go through, just like with friends, right? The more you go through, the more you feel bonded. And the other point is, you know, your doctor's a person too. They have bad days. You know, they may have just had like a horrible day in the OR with, you know, complications, and they're just not at their best that day. So, you know, I would say, like, don't necessarily write them off like with one bad experience, because they may redeem themselves.
It wasn't until like maybe 4th or 5th surgery with Dr. Reiser, she said, you know, I don't deal with emotions, I deal with eyeballs. But I can send you to someone who can help you. Yeah. And I'm like, okay.
It's true. I think I had a glaucoma surgeon on the East Coast, and he was very much, I don't know if you've seen that TV show House that used to be on TV, and yes, very much that brilliant mind, but anything that came out of his mouth was usually really toxic. And so I had to realize that I'm there for his brain, not for his winning personality. And so I just had to, you know, kind of have that expectation, but I was determined to crack him and make him smile at least one visit, every visit. So I'd force my dog to go over and say hi to him.
Oh, that's it.
So I
That's
finally
a good
won him over.
move.
Big
Dog.
win.
Yeah. You have to be off the clock for that, though.
Right.
Dog, right?
Right. Yeah.
So you're not supposed to pet a seeing eye dog. They're working. It's a true statement. Okay, good. I mean, and from my perspective, I will say from a doctor's perspective, I am never offended if someone gets a second opinion. In fact, I encourage it. I like it. I want to make sure the thing that I'm doing, someone else either agrees or disagrees, and maybe I'll learn something. I also want the patient to go to a specialist that they're comfortable with. You know, I tend to be pretty warm with my patients and chatty, but there are days where I am not. Like, I just need to get through the exam. And it's hard because the patient who sees me every 3 months and expects, like, you know, a conversation with me, sometimes we won't get that if it's like, let's say I have a procedure or something like that. And you know, at the end of the day, yes, you know, from the doctor's perspective, we have such a small time with you in that room to think about a very complex eye situation and all the things that can come from that complex eye and all the surgeries. I mean, when I talk about surgery, I'm planning 3 surgeries ahead, and I'm thinking about all those things. And we're trying to do that while maintaining about 10 patients waiting for you and still trying to have a good, pleasant personality. It is tough some days, you know, but I do encourage it. I always encourage second opinions. and we're never offended. And tell them, you know what, send it to my doctor. I always ask the patient, do you want me to send it to your doctor? Whatever the opinion is. And then they'll be like, yes or no. Or they're like, oh, I don't want them to know I'm seeing you. And then that's up to you guys. But
I also started having my appointments at the end of the day
yeah.
so I could have more time.
Oh.
But even after, maybe like you said, just developing that relationship over time, a few years into our relationship, when I got into the office, she would say, okay, tell me what you found.
Yeah.
He already knew that I would come in with like, okay, I was reading something.
Yeah.
But now she sits and listens to me and she allows me to have that time. And then she'll come back with, okay, well, I don't want to try this because blah, 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 right? And then we'll talk about it.
Yeah. No, that's incredible.
I think that's a great tip. If you do feel like you're not getting enough time from your doctor, if you're the last patient of the day, that's when I relax. I'm like, okay, there's no one waiting for me.
Yeah.
50 questions, I can answer them all for you now. So that is a good tip. And sometimes, depending on how the doctor structures their patient flow, sometimes also being one of the first is also a good time because, lots of patients are doing in testing and there's not really a lot of patients ready for your doctor, so.
Yeah. I personally tell my patients to be the first patient of the day for me in my schedule, but I'm always like, I start on time. So, but because once you're like at the 10, 11 o'clock patient time, it gets a little hairy in there. So you first patient or last patient, depending on the doctor. You figured it out because you've been there so many times, right? I have a question for Dr. Giacconi. If I have a confirmed case of glaucoma and access to a glaucoma specialist, why would I choose to see a generalist?
We train comprehensive ophthalmologists, and I'd say I have a lot of confidence in a lot of the residents that we train. They get a lot of glaucoma experience in our program, so I think your comprehensive ophthalmologist may be really fantastic, especially some people have sort of a special interest in glaucoma and they'll be really educating themselves in glaucoma, going to glaucoma meetings, going to train in glaucoma surgeries. So it's gonna depend. It's gonna depend on your doctor and on maybe your level of glaucoma. If it's, I don't want to say run of the mill, but if it's a little bit more basic glaucoma, totally fine. If it's really advanced with 39 surgeries, then I think you should go see a glaucoma specialist.
Yes, if you're having multiple surgeries, it should be with a specialist. Okay, I'm going to turn it around to a little bit of low vision. We have a few minutes left because we have a lot of questions about that actually, so I wasn't able to get them answered last time, not all of them, but okay, what kind of lamp suggestion for glaucoma? And I'm assuming that means maybe your daily lamps around the house? Any kind of suggestion for like bulb or lighting in general?
Well, with the LED lighting, you want to make sure that it's the right color temperature for you. Cool white versus warm white is a simplistic way to approach it, although there's more color temperatures called degrees Kelvin than that, because the usual type of lamp that you find in the store is a very bright white, daylight white. It's too much in the blue region, which is too glaring usually for the eye. But that's the usual lamp that you'll find. So you want to find out, do I do better with a warm white, say something at 3,000 degrees Kelvin? And you can find that at Target for that matter. Right? There's also, in fact, the GE line has a Reveal, which at first was called a daylight color temperature light, but it's about 4,000 degrees, which is near daylight. They have brought out a Refresh light, which is Recharge rather, which actually is a much brighter daylight, and then they have a Relax line, which is a warm white. Right? So it is an individual preference. There is not necessarily a particular eye problem that goes along with a certain color temperature light, but then if you think about it, we all have different houses too, right? We all have different living arrangements. We all have different types of blinds, whether it's blinds or drapes, or whatever it is, and what color the room is too, what color the furniture is too. So it's not just one particular one, but I would say that, again, the typical lamp that you find is a really realistic LED lamp that you find is just too glaring. It needs to have a lower or warmer color temperature to it.
It is sometimes hard to find a non-LED light, you know.
Oh yeah, oh yeah.
It's
yeah,
just,
yeah.
it's all turned to that. So are there, you may have already answered this while I was looking at this, but are there places that you recommend to look for those, or, you know?
Well, besides the low vision clinic, right?
Yes. There you go. Another
Well,
plug for the low vision
actually,
clinic.
if you go to a craft store like Joann's, they have a lot of lights there, to say the least, right?
Interesting.
Right.
That is good advice.
Yeah.
I have been to
Yeah,
Joann's
so-
a bunch of times. Haven't found that.
There was a study a number of years ago where the researchers went into patient homes, and they found that at home people had much dimmer lights than you would have in an office. So their functional vision was actually worse at home than it was what was being measured in the office because of the light. Like you lose contrast sensitivity. So you actually, to improve reading and stuff, you do want brighter lights, I think.
Right.
Would you agree with that, Dr. Asano?
Yeah, well, the big problem was that, actually, when I would see patients, what I would ask them, instead of bring the overhead light right directly on, say, a near card, I would ask, oh, by the way, what type of reading light do you use? And I would get a blank stare, and they would point at the ceiling light, and that was it, 98% of the time.
Yeah.
So very inadequate lighting.
There's another question, if low vision clinics help with rehabbing the difficulty of transition from light to dark that glaucoma patients have, or bright light environments to dark environments. Is there like a rehab process for that you do?
Well, one trouble is that I didn't really think of until late last year is that what is the problem is in the examination room, we just have that one color temperature light, right? We don't have variable lights for that matter. So, and we don't have a situation where it would necessarily mimic what's in the home, all right? Even evaluating glare sensitivity or a glare filter, how do we do that the best? Because at different times of the day, the sun is at a different height, has a different color temperature. Near at dawn versus dusk, it's a lot different from high noon. So how do we properly evaluate a filter for that? Right.
Yeah, that's hard. And when people ask me questions on that.
Well, I talked to a company about that who was asking me, what is there to low vision besides magnification? Luckily they asked me that. And I said, well, one of the problems is contrast. One of the problems is desaturated color, for that matter, and testing at different times of what is the best. We need something that simulates different color temperatures during the day. Not all different times of the day, of course, but maybe at least 3 or 4 of them. All right. And so they said, and then digitally put in a color filter instead of holding a filter in front of them. Right, but no more than say 3 or 4 of them, because then we get endless, and it's too difficult to do that electronically too.
So we have just another minute or so of this panel discussion. Is there anything else that you guys wanted to share about the journey? I mean, you've shared so much, and we so appreciate it, really, from a doctor's perspective, for both of the patients coming out here. But anything else that you missed that you really wanted, some burning last-minute things that you wanted to say?
Yeah, actually, I talk about empowering yourself as a patient, and I think that when you get diagnosed with glaucoma, obviously it's terrifying. I mean, I think I mentioned earlier, my only reference for knowing anybody who was blind or visually impaired growing up outside of Manhattan was seeing homeless people on the subway that were panhandling with their guide dog, and I thought, oh my gosh, this is what my life is going to look like. I'm going to be poor and have to live off of the state. I'm not going to be able to work. I'm going to be a burden to society. And I think that that's unfortunately a stigma that a lot of people associate with blindness. They don't know a lot of high-achieving people that are low vision, and so like if I can be anything to you today, I want you to see that there really is no sky. There is no limit. The the limit is beyond the sky for what you can do. But the way to do that is to A, advocate for yourself, and B, when you don't feel strong enough, I think it's important for, and this is something I'm really fighting for, and I'm working with companies like I See Better to make sure that we've got patient advocates in every major eye hospital in the country. So the second you get diagnosed and you have that terrifying news that you may lose your vision to glaucoma, somebody's going to hold your hand through the process. Somebody's going to talk to you about your drops. They're going to talk to you about the life changes that you may need to make, whether that's driving, caring for your children, the life skills that you're going to need, the resources that you may need in the Braille Institute. But having a designated person who's an expert in that area, or a nurse or a med tech or an ophthalmology tech who can say, listen, I've got you. It's okay to fall apart this first week, but we're going to make sure that you stay compliant. So you're doing your part to be a master of your disease, and I will make sure that I'm going to be the big bully that's fighting with insurance and fighting with pharma to make sure that you can afford your treatment and that you keep coming back week after week through this journey. And so that's patient advocacy is a passion of mine. I really think in this day and age, it breaks my heart and angers me to no end when I hear people losing their vision to a very treatable disease because of non-compliance. And so I think A, empower yourselves to be your own advocate, and B, if you can't, get a family member, talk to your doctor, talk to the nurses, and make sure that they're building you up and they've got your hand through this, because nobody needs to go through this alone. I'm not gonna lie, it can be really, really scary at times, but everybody in this room is here to support you. So just know that you just inherited 150 family members who are gonna be all over you, through your next surgery and everything and beyond.
That's wonderful. Yes. Dr.
There is on how to find a low vision specialist. After the program, all of you will get two resources on how to find a low vision doctor. There is a low vision prescriber network that just came out late last year, that it's a project of the Vision Council, the low vision section of the Vision Council. And you just, by going to that link, all you have to do is go to state and zip code, and it will tell you who is in that area who does low vision care. There is also another resource, which is through the American Optometric Association, where it's called Find a Doctor. It's also a link that you'll all get, where again, by state, but this is also by specialty also, since it's not just low vision. All right. Another thing that I wanted to touch upon is that how do you prepare to go for your low vision evaluation? Make sure that you identify what kind of problems do I have in my everyday life that creates a problem. Because I've had patients come in who said, well, just make me see. Or patients said, I only want glasses, I'm not going to wear anything else. But they didn't specify what it was. So what do you have problems? Do you have trouble seeing the food on your plate? Do you have trouble going down your own steps? Do you have problems seeing somebody's face when they're against a bright background, for that matter? Right? So there's all these different things. There's a person, well, they get close to television. Well, why do they get close to television? What happens when they get further away? And it wasn't just magnification, it had to do with their field of vision, but they didn't know that. So if a person, I can identify certain goals, for that matter, and because we can't take care of all the goals all that one visit. Otherwise, I'll be with a patient for 4 hours and they'll be exhausted. So will I. But so address primary goals, and then the next time say secondary goals, right? Because there's not one answer that fits all, to say the least. All right. There's not one technology that fits all either.
Thank you.
I've just a very quick, if anyone's a veteran, even if you're not enrolled in the VA, they have a fantastic low vision program, and they actually are looking for blind veterans, low vision veterans. So I think you can get into that program even if you're not enrolled now.
Okay. I'll give one more piece of information. So I work for a practice called Advanced Vision Care. We're a private practice in Century City. the practice's original owner is Dr. Sam Maskett, who is a world-renowned cataract surgeon, and he is basically retired, but he does have a foundation. It's called the Maskett Foundation, and this is for patients who don't have insurance and and need complex eye surgery. It's not a clinic for like daily checks, but if they need, for example, a glaucoma surgery, or they need their lens sutured in for some reason, things that, that just are necessary, but they don't have insurance, or are on some kind of plan where their insurance doesn't have that specialist, then I would encourage you to look into the Maskett Foundation. We have donors with a fund that helps pay for those surgeries, and the doctors work pro bono for those cases. So I just want to put it out there. And, I asked Dr. Maskett, I'm like, if I advertise this, maybe a lot of people will come. And he's like, I will do this until all the money runs out. And that was his, I just thought that was like a really nice way to say we will do it till the money runs. So if you do have somebody who maybe is on Medi-Cal only and needs a urgent glaucoma or cataract or some surgery that can't be helped by a community doctor, then please find the Maskett Foundation and we will get you hooked up. Okay? So with that, I'm going to thank you so much for this incredible session. I'm going to have you guys leave the stage and introduce our next speaker. Thank you.